Hello family, welcome yet to another episode of Masapharm podcast. I'm Claire Arinda, your host for the day, and I'm back with Dr. Joseph. Dr. Joseph, you're most welcome.
Yeah, thank you, Claire. It's always a pleasure to be invited to be part of the Masapharm podcast, and I hope that this interaction again will have an impact on one or two people. Thank you.
All right, our topic for today, we're going to discuss about UTIs and yeast infections. I know many people out there be dying with a few scenarios or situations with their health, and some people fear to talk about them. Reason being, like for this topic of UTIs, most people fear to be judged. And the issue is like both women and men, some feel like if they talk about it and they be like, I have this or I have that, they'll be misjudged and think maybe they got it from sexual intercourse, which is most likely not to be the case. So today, with Dr. Joseph, he's going to enlighten us, tell us more about how UTIs are, what they are, how do they come about, how do we manage them, and people who come with recurring infections, how do they manage? Dr. Joseph, please take us through.
Yeah, thank you very much. And this is a topic that I'm sure is lingering on a number of people's minds.
Yeah.
So in her submission, she mentioned of UTIs. She also mentioned about yeast infections. Yeah, true. So to just share something small, these infections usually affect us, both the males and females, but from my community practice, I've come to realize that it's mostly women who tend to come most to seek Medicare.
Yeah.
So it means that also men are there, but they just have them and they do not want to seek Medicare. So with this interaction and through this podcast, I hope that we shall shed that light. Now, UTIs, these are urinary tract infections. It means that they affect the urinary tract system. Yeah. So you also mentioned about yeast infections. These are fungal infections that also affect the urinary system, but then also the genital system. So as you realize, there are mainly two systems that are at play. We have the urinary tract system. We also have the genital system. Yeah, so I think as we dive deeper, you shall be able to go into these infections. So, but just to bring it up to us, there are two main systems that are at play. We have the urinary system and then the genital system. Now these systems anatomically, when I say anatomically, I mean there's a way they are related in terms of where they are located and how they are formed. If you have to look at how they develop, they have a similar source, embryological similarity, and these two systems are close to each other. So in most cases, the infections that affect the urinary system, some of them may be as a result of some of those organisms coming from either the genital. So there is that relationship. So I think as you guide in this discussion, we shall be able to dive deep into that.
All right.
Yeah.
So as you've heard, so Dr. Joseph, could you kindly tell us, describe for us how can or differentiate that I have a yeast infection or I have a UTI through the signs and symptoms? How do I know that this one is a UTI, this is a yeast infection?
All right, urinary tract infections, they affect the urinary system. And there's what you call a UTI, there's what we call an STI. UTIs tend to affect the urinary tract system. And then usually STIs target the genital system. But then these systems are related. And sometimes you can have what you call mixed infections. Now, let me start with a UTI. These are infections that target the urinary tract system, but let me first unpack what the urinary tract system is.
Yeah. We
have structures that form part of the urinary tract system, and we have the likes of the kidneys. Kidneys are bean-shaped organs that are found within our bodies, and they play a key role. When I say key role, one, they help in filtering blood so that they remove toxins from blood so that those toxins can be eliminated through urine. Most of us know it for that role, but the kidney also has other roles. For example, producing certain hormones that are used in blood formation. Kidney is also helping activating vitamin D3, the one that we get from the sun. So we have the kidney as one of the important organs that form part of the urinary tract system. We also have the ureters. These transport that urine to the bladder. We have the bladder. This is it's like a store for this urine up to when you feel that urge to go and void or to empty it. And then we have the urethra. The urethra serves to pass out urine whenever you want to do so. Now, the urethra in women mainly serves one role, but the urethra in men plays two roles. One is to assist in eliminating urine, but then also to assist in passing the sperm to the vagina during intercourse. Now, why am I going through all this? It's because when you speak of such infections, you are going to find me speak of progression of these infections. They can start from the urethra, but if left unchecked, untreated, they progress to the bladder. If left unchecked, they can progress up to the kidney. And that's not something to take lightly. Yeah. So we have spoken about the urinary tract system.
Yeah.
We also have the genital system. It's important that we appreciate these systems. When we speak of the infections, you'll hear me mention most of these organs. So the genital system, in females, we have the ovaries. This is where the eggs are formed. We have the fallopian tubes. We have the uterus. We have the cervix, the vagina, and the like. Whereas for the males, of course, we have the testes, we have the tubes, the likes of vas deferens, the epididymis, we have the prostate, and the urethra. So the urethra in men serves two roles: for genital purposes or reproductive purposes, but then also for urinary purposes. That aside. So when you speak of the UTIs, they target the urinary tract system.
Yeah.
And oftentimes, the commonest organisms that cause these UTIs are actually part of us. Some of them, we consider them as normal flora. When I say normal flora, these are like good microorganisms, good bacteria that help to compete or to outcompete the pathogenic bacteria. But you see, this normal flora in a given part of the body, it can tend to be pathogenic. In the case of UTIs, there is a common organism implicated, and that's what we call E. coli. Those ones that have done some medicine or who are at medical school, you could be familiar with this. So we have E. coli. So in the GIT, it's a normal flora. But then when it crosses to the urinary system, it becomes pathogenic. Yeah, it becomes pathogenic. And sometimes this can happen either because of our hygiene or the way we clean ourselves. You may find that you are transmitting or you are pushing these organisms from the GIT, either when you are going for a long call and then you clean badly, you may transfer these organisms to the urinary tract system. And if that happens, you'll experience the first thing you need to appreciate is that the urethra is the first point through which it starts to colonize. Yeah. So when that happens, you'll find that some people will experience some sort of painful, we call dysuria, either painful urination or that difficulty in urinating, or that burning sensation when they are passing out urine. So when someone has a UTI, oftentimes there is that difficulty or burning sensation or painful urination. That is a hallmark feature for someone with a UTI. These UTIs, like as I've said, they start to colonize from the outside part. So they start from the urethra. When they colonize, you experience cases of dysuria. And when I say dysuria, this is burning sensation when you're urinating, or painful urination, or that discomfort when you want to pee. But when left unchecked, it can progress, and it can progress up to the bladder. So when it reaches the bladder, in most cases, it will be causing that need to empty the bladder all the time. So there's that increased frequency in urination, or that urge in urination. So again, when this is left unchecked, it can progress up to when it reaches the kidneys. And in most cases, when it reaches the kidney, it means you have really not cared about treating this infection. And in most cases, even the treatment is longer. So in a nutshell, for the case of UTIs, depending on the progression, the symptoms may just keep adding. Yeah. But the hallmark features, one, there is that painful or discomforting urination, or that burning sensation when someone is urinating. Two, there is that increased urge to urinate. So there's that increment in the frequency. Sometimes, when it has maybe progressed to reach blood, someone can present with fever. Yeah, there are those that present with fever. Now, in the issue of the men, for example, the men, there are other organs which can get involved. For example, the prostate. And in most cases, when it is left unchecked, you find that such men may experience what we call perineal pain. Yeah. When I say perineal pain, I don't know if you know the perineum. For the purpose of the people out there, the perineum is that diamond-shaped space between the thighs, from the pubic symphysis up to the tailbone. So that space houses the external genitalia and even the anus. Yeah. Now that space is important because it houses what we call the pelvic muscles, and these muscles play a key role. Maybe when someone has gone to defecate, maybe during intercourse, these muscles play a key role. Now these muscles, when someone has like a UTI and has affected the prostate, remember the prostate is supported by these muscles. So when there is inflammation, there is also that pain that radiates to that perineum. So in most cases, men with prostatitis, meaning UTIs that have really affected the prostate, they tend to have perineal pain. And that's a hallmark feature. Yeah. So in a nutshell, for the case of UTIs, it depends on the progression, and that's when the signs may slightly differ. But over and above that, the commonest, there is that difficulty in urination, and then also frequency, increased urge. There can be fever, and then there can be perineal pain for the case of the men. Yeah. When you come to the yeast, now yeast, it's a fungal thing, and you said manifestation. So people with yeast infection tend to have a discharge, and it is thick. White coated cheese sort of discharge, and usually it's associated with itching, pruritus, itching. In fact, there are ladies, you can see a lady in public well dressed, then you see her scratching herself. You never know, sometimes it could be due to such a yeast infection. Then also for the case of the ladies, they can tend to have erythema due to that itching. Even there can be some swelling, but those are all secondary to itching. So for the issue of yeast, to be clear, it is thick, in most cases thick, and it is whitish, cottage cheese sort of discharge, and usually associated with aging. It can also affect men, but for the issue of yeast infection, so common in women, and the reasons are many. I think as we go, we can really unpack all those.
Right. So as we go through that, I'd still want you to enlighten us and tell us how best can we avoid contracting those infections, and if at all we have them, how do we treat them? You know, some people some do self-medication. They just feel like, if at all I have this, I need this kind of drug and it will treat me. Then they come the next period and it doesn't work. So which drug works best for UTIs? Which drug works best for infections? And how best can I manage it if at all I've been having it and I don't want it to keep reoccurring? Thank you, Claire, for those crucial questions. You asked about one, how best to avoid, and then two, how best to manage. You also spoke about different drugs. It's true that some of us can actually be there, you stay a long life without really contracting these infections. It is possible, and you need to take precautions. Now, for the issue of the UTIs, one, you need to maintain that personal hygiene, very key. But you'll allow me that as I talk about UTIs, I may deviate slightly and talk about STIs, because sometimes they can come as mixed infections. They can come as mixed infections. So one of them, like as I said, hygiene. Hygiene is very key. And when I say hygiene, it means toilet use. When you go to ease yourself, if you have to clean yourself, you clean from the front to back and not the other way around. Why? You're trying to prevent any possible means of transferring those microbes from the GIT to the either genital or urinary system. That's one. Two, we also advise that you need to, for example, when you use like toilets, you yourself, you may be clean, but if the surrounding is dirty, definitely someone who has been having such infection and use the same facility, given the fact that usually ladies have what you call a short urethra, when you urinate and there is that splashing, some of those microbes might splash back to your external genitalia, the vagina, and then from there they migrate to colonize the urethra. That's also possible. Then also three is you need to boost immunity. It's important that you really need to boost immunity. Why? There are some infections that come when the immunity is low. Then the other point is you need to ensure what you call rational use of these antibiotics. You see, antibiotics are good actually since the beginning of the 20th century. When these were discovered, they played a revolutionary role in advancing Medicare. But due to irrational use, some of them have started being ineffective. So we need to ensure rational. And when I say rational, is that you shouldn't self-medicate. Why? Most of these are broad spectrum, so they also end up killing the good bacteria. I'll just mention some. So in the female and male external genitalia, we have some good bacteria like lactobacilli. These are good bacteria. And when I say they are good bacteria, it means they try to outcompete the pathogenic ones from colonizing us, the hosts. So when you kill them by using the broad spectrum bacteria, you leave your systems unchecked, that when you get exposed, you can easily be colonized. So in short, we need to regulate, or we need to minimize or avoid self-medication, especially when it comes to using antibiotics. Then for the issue of the yeast infections, how you can try to avoid, of course some of them may cut across. One is that you need to have, now like for yeast infections, sometimes it's common when
maybe someone's immunity is low, or when now there are those that may be really hard to completely avoid. For example, ladies who are pregnant, they become so susceptible to yeast infections.
Yeah.
So you may not avoid completely, because if you are really pregnant, it means you are actually at high risk. But you may have to take additional precautions like hygiene, putting on dry panties. Yeah, not wet. At least they should be dry. Yeah. Then also, sometimes we take broad spectrum antifungals, so they also tend to kill the good bacteria, the good yeast things. So we need to basically look at hygiene, but then also to rational use of these antimicrobials, and then also boost our immunity. So that's how you can try to avoid or minimize in certain cases. Then also for ladies, there are these who are either going towards their periods or after their periods. They tend to be susceptible to these yeast infections. So you can do prophylaxis. It's also one way to avoid getting them. And for the issue of prophylaxis, you can consider using what you call probiotics. We have probiotics, and the purpose of I think I'll talk more about probiotics when I come to management. But these probiotics, they have immune modulatory purposes, but then also they provide the body with those microorganisms which are beneficial. Then also, which is key, before I forget, is that sometimes ladies get these infections due to changes in the pH of their vagina, and sometimes we do things that really alter the normal pH. One of them is douching. Douching is actually highly discouraged. When I say douching, this is when a lady tries to wash inside the vagina. On the issue of trying to prevent or avoid these infections, one is that we need to maintain the natural pH on the issue of the ladies in our vagina, and it is usually acidic, ranging from around 3.8 to around 4.5. So oftentimes we as ladies, we do things that can alter the pH, and some of them, the commonest is douching. This is when a lady, maybe she has been having bad smell or bad odor, so in a bid to counter that, they want to wash everywhere, including inside. Now that is not good. I discourage it, I condemn it. Why? The soaps that we use, they are alkaline, sodium lauryl something. These are alkaline compounds. So they go and try to increase the pH. And when the pH is increased, you'll actually end up with what you call bacteriovaginosis. Now that is something you should take note of. So that's how you can try to avoid these infections. But also, most importantly, there are those infections that come through transmission from one person to another, and this is what we call sexually transmitted infections. And to avoid them, one, you should really minimize on the number of partners that you get. Why? The more you get many partners, sexual partners, the more increase on your chances of getting those that are infected and they can transmit to you. But then also too, in case you are not sure of the partner, you can use protection, barrier, like use of condoms. But then also true, now this is to the side of men. There are those that say, statistics or research shows that circumcision reduces on the risk of transmission of these infections. So on the side of men, I know some cultures may discourage, but medically would encourage men to be circumcised. Ladies can actually testify on this. So that's also something that men can also look at. So I think that explains how you can minimize on some of these infections.
Okay, allow me cut you short. Before we proceed, you talked about pH balancing.
Yeah.
And you said you gave an example of douching.
Yeah, true.
But as I was encountering and making research, I met a client and they had a question.
Yeah.
Is it true that also emergency pills lead to the lowering of the pH? Because I asked her and she tells me her UTIs, sometimes she's clean. It's not that she shares toilets, but going deeper, she uses a lot of emergency pills. So she posed the question to me. So I would like you to answer.
Okay. Good question. Now, emergency pills, to begin with, by the way, before I jump into that, another reason was why people may also have infections. Now, this is common in postmenopausal ladies. It's because of the low levels of estrogen. So, usually in postmenopausal ladies, we advise them to maybe use estrogen creams. Yeah, its purpose is to increase on the nourishment of their private parts. That done, here's a question about emergency pills and alteration of the vaginal pH. And one, emergency pills, these are a method that we use to prevent someone, a lady, from getting pregnant after sexual intercourse. And usually they work within a space of 5 days. There are those that strictly we try to restrict to 3 days, and the earlier you use it, the better. Two, emergency pills contain, some of them contain hormones, and the commonest hormone being progesterone. How does it work? It works by delaying the release of the egg. That's one. But then also it can thicken the cervical mucus such that the movement of the sperm is delayed. Do they have an effect on the pH? Well, not documented per se, yeah. But then also to such a client, I'm also meant to believe that if someone is routinely using emergency pills, it means they're having regular and protected sex. Yeah. And remember that the more you have unprotected sex, especially with multiple partners, the higher your chances of getting a partner who is infected and can transmit that infection. But that's one point. Number two, due to irrational use of these antibiotics, that's called antimicrobial resistance. Yeah? Yes? So, it's true that you can get an infection, you treat it, gets done. It's also possible that you can get a resistant infection that even if you treat, it can be stubborn to completely eradicate. That's also possible. Then also, it's also possible that if someone is to treat, they complete that dose. Yeah, it's also possible. You see, by the way, the single most reason was why people seek Medicare is because of pain or because of the discomfort. Had those two not been there, people would actually just be with infections untreated. And this is common with some UTIs, especially in ladies. There are those UTIs that are symptomatic in ladies, especially those due to chlamydia, sort of bacteria. And that's why this explains why some men, they can be feeling okay, the woman is feeling okay, they have intercourse, and then it's the man who complains. It's because certain infections are asymptomatic. So, to answer your question, does emergency pills predispose to someone having infection due to changes in the pH? My response to that is no, at least from the medical perspective. But it's possible that whoever uses emergency pills regularly, it means they are having unprotected sex, and it means some of the people that they have intercourse with could have these infections. And it's also good to note that if someone is to treat, they finish their dose. Why? If you do not finish the dose, there are two things. One, what you're trying to eliminate is going to come back. And then sometimes you start choosing the Vasal, the medicine you give me does not work, or what, you hate my money. But sometimes because we as the patients, we do not finish the dose. And the second point is that when you do not finish the dose, you also give chance to these microbes to mutate. When I say mutate, they change their form, in that the drug that used to kill them no longer kills them, and they become resistant. So those are key things that all of us need to take in note of. In fact, Uganda was ranked as one of the countries in the world where there is misuse of these drugs, and self-medication is one of them. So to answer a question, to such a client or to such people that are usually having recurring infections, this is what they're supposed to do. They're supposed to do some tests. You go to a lab. There are those different types of tests. There is one where they remove your urine. There are those that they can remove the swab. Then there are those that we do what we call culture. So we try to ascertain exactly the organism responsible, and then we try to find out the right medication. And I can assure you, for that lady, you continue using the emergency tools. If let me say this, if she does that and then she gets the right treatment, she gets well, she will now continue using emergency pills without infections, than her to continue using them without treating the infection. Yes. Yeah. I don't know if I've answered your question.
Yeah.
Okay.
And my next question, you talked about personal hygiene.
Yeah.
One or two cases I've actually encountered young babies, girls most especially. Parents come and they have complaints. My car baby is feeling itchy down there. She's always scratching themselves and always crying. What predisposes those young babies at that age, 2 years, 3 years, to such kind of conditions?
I mentioned 2 points. One was hygiene, another one is immunity. Yes, usually when the baby is inside the womb, there's a way the baby is protected. There's a way God made our body that when you're inside the body, there's a way you're protected. Now, when the baby changes the environment, comes to the world, she gets exposed. Some of them get allergies. There are those that face difficulty breathing. So there are those that also get exposed to these microbes. Now, if their immunity is low, it's true that they can actually get sick. That's why when the mothers that have given birth to these kids, when they leave, if you have really been recommended, you get some multivitamins, to enhance in development, but then also to boost immunity. So the reason was why such babies tend to have such infections, one is because of the environment in which they are. And when I say environment, hygiene is part of the environment. So do you clean them well? Most of them, when they susu, when they poo-poo, you change the diapers, promptly, so that is also a key factor. Then also the immunity. So babies are supposed to be given supplements that enhance growth and development, but then also boost immunity. So to such mothers out there that have babies with such recurrent infections, it's good to assess with the help of a doctor how is the immunity. And you can find out this when people do a CBC, depending on the number of the white blood cells they can say that because of this low level, the immunity is down, depending on a certain class of white blood cells. So immunity is key, but then also hygiene. But these are manageable, so it shouldn't be a big worry. In case there is a kid out there, the mother can always seek medical care from a professional who can guide them well. All
right. Thank you, Dr. Joseph, for being part of us today. And I hope you guys have learned something. And please, don't do self-medication, always go to the doctor for checkup. So as we conclude, any concluding remarks for us?
Thank you, Claire, for having me on this podcast. Maybe as we conclude, we did not talk much about STIs, but STIs are actually key, and sometimes they come combined. And the common ones, we have the likes of gonorrhea, which most of us know as Nziku. We have the likes of syphilis, that most of us know as Kapotongo. Yeah, we have the likes of HIV, we have the likes of genital herpes. Yeah, we also have the likes, and lately, what you call HPV, which predisposes ladies to having cervical cancer. Yeah, so it's important that to take caution. You minimize on the sexual partners that you have. You try to be cautious, especially if you do not trust that the partner may be having certain infections. You can always use protection. It's not a crime. Yeah, and then in case you have such infection, you treat as soon as possible. You see, these infections, when left unchecked, they progress. And on the issue of the STIs, they can actually predispose to infertility. When you look at the complications, they can predispose someone to infertility. And if, for example, if someone have maybe unchecked infection, they can progress. They can cause maybe infection of the fallopian tubes. And when these infections, when they are there is inflammation and scarring. And that happens even in blockade. So you realize that most people that do not treat these infections, they may have challenges later in life and they want to give birth. Yeah. So it's also good that you treat these infections so that you do not, to the case of the pregnant women, you do not transmit to the babies. Now, like for the issue of gonorrhea, yeah, if the lady has gonorrhea when she's pregnant, she does not treat, and she's giving birth, it's not well handled, you may find that such babies may actually become blind, what we call tramia neonatal, yeah, or conjunctival blindness, yeah, or neonatal blindness, or neonatal conjunctivitis, which is not good. But then also some of these STIs like trichomoniasis, when left untreated, when someone is pregnant, they can predispose to preterm birth, or they can give birth to babies with low weight. Yeah, so the point that I'm trying to underscore here is that in case you detect such infection, you need to treat as soon as possible. Number two, it's good that you finish the dose as recommended by the MUSAO. Three, it's also good that you also tell the partner to also treat. Yeah, it is actually like washing clothes and hanging them in the mud. When you have a partner, you both have an infection, you only treat and do not tell them to treat. It means that they are going to reinfect you. So if you're in a relationship and you have an infection, it is courteous of you to also tell your partner to treat. Yeah, so once we do that, then we can minimize on the spread of such infection. And then it is the one way how we can counter this infection. I thank you for hosting me, and I look forward to further engagements. And I thank you all, people, always looking out for such informative content. Thank you very much.
Thank you, Dr. Joseph. So I would like to thank you all for always being part of us, being part of Masapharm podcast, and we shall keep engaging with you guys. So keep your questions coming. Thank you, and keep following us both on Instagram, Facebook, TikTok. Thank you very much.